Welcome to the introduction to Module 1, the pelvic floor and core, foundations in anatomy and function. So about this module. So this module can be taken as a module in isolation, so you may wish to take it on its own, or you may want to take it as part of the full Pilates in Female Pelvic Health course and qualification. So the module is going to be a combination of theoretical and practical workshops to really help consolidate your understanding in the anatomy of the pelvic floor and core, how everything works together as a system, and then how you can then apply that knowledge to your classes and your clients and your one-to-one Pilates sessions. By the end of the course, you will be asked to complete a very short examination. This will be an online multiple choice informal test that will really help to solidify and consolidate the learning that you've developed over the course. So just looking at the module content, what are we going to cover on this course? So we are going to be looking at a deep exploration into the anatomy of the pelvic floor and core. So obviously we're going to be looking at the muscles, but we'll also be looking at associated soft tissues and bones and nerves. But then we'll also be bringing all of that together, and we'll be looking very closely at how those tissues and structures work together as a system, which is really important when we're thinking about our Pilates principles, what exercises we're giving to these ladies, and it really sort of developing our own repertoire and strategies in how we may be bringing exercise in and delivering exercise to our female clients. So we'll be looking at various different practical elements in this particular module. One will be looking at how you cue at the moment. So we'll be looking at how we can actually get the pelvic floor and the core activating, how you're currently doing that, and how you may want to think about alternative strategies, or maybe changing your practice in terms of how you cue to help encourage your female clients to really engage with this particular area of their body. We'll be looking at recognising signs and symptoms that might indicate if the pelvic floor or the core system has become dysfunctional. So what might we be looking for from both a sort of subjective point of view, so what the woman may or may not tell you, what perhaps we need to be screening for, but also physical signs that may indicate that maybe something might not quite be right with this lady's pelvic health. We'll be also looking at when to recognise some more concerning signs and symptoms which may indicate that your lady may require an onward referral, and we'll be discussing who perhaps she may need to be referred to and how we may go about that process. We'll be looking at the Pilates principles, so particularly in terms of posture, in centering and breathing and positioning, and looking at how we cue and teach these various different principles, how that may impact on a woman's pelvic health, and how perhaps we may be needing to rethink or reconsider how we're teaching these principles to women. So then we'll be looking at how to apply all of that knowledge into our Pilates practice, both on a one-to-one level, but also in a class setting. So what exercise strategies might we want to use? How might we be changing our current practice to consider the lady with pelvic health issues? So as mentioned, at the end of all that, you will be asked to complete a very short assessment process. Really for your own benefit, so really to consolidate your learning and from a reflective point of view, to see how you have developed really over the course of the module. We'll be encouraging a lot of reflection throughout the module. So looking at where you are at the start, where you want to be, and how you envision yourself getting to that point. So we'll be looking at learning outcomes and goal setting from your own personal point of view and perspective. So we really want to encourage your development and hopefully thinking about change as well. So it's fine to change. It's okay to say, oh, actually, perhaps I shouldn't be doing it that way, or I've been doing this for 15, 20 years. Perhaps now I need to be considering a different point of view. Things do change all the time. New research is coming out all the time, and it's okay to change and develop as a Pilates teacher and practitioner. And so we really want to be trying to encourage that throughout this particular module. So at the end of the module, you will receive full references and appendices of all the research that we've talked about throughout the module. And we'll also be giving you some sources and ideas of how you might want to look up your own research around this area in the future. So I hope you enjoy this module, and I look forward to cracking on with it with you soon.